Okay, so I'm going out for my evening run, and it's like the only time that I will be sitting still. Okay, so like the only time that I'm actually sitting still is when I'm driving, so just bear with me while I give everyone the lowdown on ego. I know everybody just wants to know like what happened so they can know how to make it so that doesn't happen to their horse, and people are just genuinely curious, and then so many friends and family, they just don't understand what's going on. Heck, I don't even really understand, but I'm going to do my best to just try to explain it, so bear with me. I'm not the best storyteller, and I'm really horrible at explaining things, especially things that I don't even quite understand myself. So a Tuesday evening, I was making dinner, and I looked outside. Ego was kind of running around, and I thought that was kind of weird. And it was like 6:30, and it was hot and buggy, and it was just, I didn't want him getting all sweaty. So I ran out there, brought all the horses in, came back inside, and finished making dinner. And I went back outside after we ate dinner, probably about 7:30, and Ego was just a sweaty, hot mess. I mean, just a wreck. And I didn't really know why, so I got him out of his stall, hosed him off a little bit, and put him back in his stall, and he immediately started like pawing, and I was like, are you like that agitated? Like, he just looked so agitated. And then usually when they're all wet, they want to roll, so I was kind of attributing the fact that I just hosed him off to the fact that that's why he wanted to roll. But then he started kicking the stall and like jumping around, and I mean, I thought he was going to jump out of his stall. So then it just kind of like hit me. I was like, oh, he's in pain. Like, he's agitated, like something's really bothering him. And if you're a horse person, you'll kind of get it, because it was just a weird fine line. First, I just thought he was like losing his mind. And I was like, what is wrong with you? So I immediately called the vet, and the vet was like, I can be out there in about an hour. Do you give him some Banamine, which is some painkiller, and I was worried he was going to jump out of his stall, and give him some Dorm, which is like a sedative. And so I gave him both of those. By the time the vet got out there, he had chilled right down. His heart rate was normal. Everything checked out normal. He had gut sounds. His breathing was normal. She decided to just tube him with some fluids and electrolytes, so down his nose into his stomach, just to make sure he was hydrated. A lot of times horses can get like dehydration colic, for some of my non-horsey friends, so it's just like an impaction from not drinking enough, especially like in the hot weather. And sometimes, they can get gassy. So a colic is just a really general term for horsey stomachache, or anybody's stomachache. So we kind of joked that maybe he wasn't colicking, maybe he was just having a panic attack about the bugs and the heat. And the way she kind of put it is that, like, if he was really colicking, or he was in a lot of pain, he probably would be blowing right through that sedation and that mild painkiller. He would be still really agitated and uncomfortable, and he wouldn't be as chill as he was. And then another thing that she brought up is, like, most of the time when horses are colicky, they don't feel good at all. Like, they just want to lie down. They're kind of pointing at their tummy. They're just kind of punky. They don't really know what's wrong, but they don't feel good. They're not usually running around or pacing the fence line like Ego was. So I kind of shrugged it off, and I mean, to be really honest, I felt kind of stupid, and I was like, well, that was a waste of about $500 to have the vet come out and tell me that my horse had a panic attack. So the vet left. I checked on him at 11 o'clock at night. He was still pretty sedated. So I was like, okay. So I went to bed, set my alarm for 2, went out there, and he was walking around his stall, like kind of walking circles. And he didn't seem like agitated or aggravated or upset or anything. So I gave him back his hay net and told him good night. And then my alarm went off at like 6:30, and I really, like, things were so chill the night before that I didn't like rush out to the barn. Honestly, I just came downstairs and I made my coffee, And then I went out to the barn and at 7, and he was just a mess. His head was like all scraped up like he had just been through the war. And he just looked like defeated. Like his nostrils were flaring, and I was just like, oh crap. And I had a weird feeling the night before, like when he was panicking, like right before the vet came there, and I had just asked Andrew to hook up the horse trailer, not because I don't know how to hook up the horse trailer, but just because it made me feel better that he was doing something to help when I felt really helpless. So he had hooked up the horse trailer, and I'm like not joking. I like took the other horses, threw them out in the pasture, like tossed some hay over the fence to them, and ran inside, put on a bra, and made sure my shorts weren't too short because I was in my pajamas. And I just put him in the trailer and just went. And we made it to MSU. I mean, we're like an hour and 15 minutes away without a horse trailer. So we made it there like by 9. And I pulled him right off the trailer. They knew I was coming in. And his heart rate was like over 100. They took ultrasound. They did ultrasound, took a sample of fluid from his belly, and they were concerned that he had honestly like already ruptured something, whether that's like some part of the intestine or like a horse's stomach can even rupture. So they were like, can we take him like right into surgery? And I'm like, yeah, go. So he was like on the table, and heck yeah, he has to watch. By now it was like, I don't know, you kind of take yourself away from it being like your horse and your pet, and then it was just like watching a TV show unfold or like a science experiment or something. Fascinating to me. So they had him, I mean, upside down and on the table. That was also the funniest thing. The number of like people that I've talked to that are just find it hilarious that he was just like, the picture that I posted of him like upside down on the table. Everybody, like the non-horse people, they just cannot believe that, and they think it's so funny. And now that I look at it, I guess it is really funny, but I don't know, I guess non-horsey people never really thought of how you do surgery on a horse. So of course I've had to explain all of that to them, and that's been interesting. But so they got right in there, and when they do colic surgery, from what I'm told, obviously don't take anything I say like as the word, because I do not actually know what I'm talking about, but they take everything, they examine everything like piece by piece, all the things that they can kind of take out and put back in, they do. Anything that they can't, they are feeling around and giving a thorough examination. And you really don't know what you're going to find in colic surgery. They were kind of looking for a twist, a knot, some dead part of the GI, an infection. Sometimes there's lipomas, which are like a little fatty tumor that will grow around a part of the GI tract and cut off the circulation. And they really didn't find anything like that, except for the last 20 feet of his small intestines had an enormous amount of inflammation. They were like red and angry and just super enlarged, almost, I mean, like a balloon had been like blown up. And on the horse has, I think, about 50 or 70 feet of small intestine. So I think it's about 70. So this was about 20 feet. And the way they kind of described it to me is that if this was like some sort of infection like salmonella or like a bacterial infection, they'll usually see that like throughout their whole small intestine, or they'll see it at the beginning of it. But because it was just the last portion of it, and it was such a distinctive area, they're kind of leaning towards the fact that there could have been a twist there, and as they were like pulling out intestines, or even as they were flipping them onto the table, that could have undone that. So we'll really never really know. But they examined everything, put everything back, and now they at least knew like what the problem was. And the problem is that we have about 20 feet of small intestine that are really, really unhappy. they didn't think that they needed to take out those small intestines because they seemed very viable and they weren't dead looking, if that makes any sense. They had blood flow and everything. They just looked sick and angry. So they, apparently he had a pretty bad cardiac episode when they first put him under anesthesia. I mean, their words were that he was really, really sick. So putting him under anesthesia, it like sent his heart into like chaos for a little bit. But, so they kind of were guarded and a little warned me about him waking up and stuff, but everything turned out okay. He woke up, he stood up. I can explain that too for my non-horsey friends. Like, putting a horse down and up from surgery is not like an easy task. It's not like a dog that you can be like, oh, just lay down here. Let me just scratch behind your ear while you just fall asleep, or let me hold your hand. It's a lot different, especially for a prey animal that has no idea what's happening and is in pain. So anyway, he got up and they got him back to a stall, and then they brought me back there, and he was really agitated, really agitated, pacing, sweating, and it was really hard to watch. So I just I left after a few minutes, mainly because I didn't really know what else to do. It was really hard for me to watch him that upset. And they reassured me that it was normal and that they were doing everything that they could and that he was okay. So I will kind of admit I was a little naive. I had always kind of been against colic surgery, but I had heard recently, probably within the last 5 years, of a couple horses just having just amazing results, like literally going in, coming out, and 3 months later, like literally back riding like nothing ever happened. And that was kind of my thought of how everything would go. Everything would just be smooth, but it wasn't. So this was all Wednesday when this was going down. Then Thursday, we opted to still go to our horse show that Thursday, because the girls still wanted to show, and the fairgrounds is a lot closer to MSU than our house, so really it would actually be a little bit more convenient for visiting them. And so we got up to the horse show, and then we went to go visit Ego, and they had warned me that his temperature spiked overnight, which is bad. And they said that he got really uncomfortable and he was trying to lay down. And they said it's really not rare, but it's unusual it's not a good thing if a horse that soon after colic surgery wants to lay down. Wants to lay down, because that means that they're really uncomfortable, because normally they wouldn't want to lay down just because their abdominal muscles, it would really hurt to get up and lie down. So the fact that he was lying down was not good. And then his temperature spiked and he began to reflux a lot. So horses can't throw up, and so all of the fluids within his system, all of the juices and things, and this is where it starts to get a little confusing for me. So if you're someone like my vet friends and techie friends, just blow past this part. But the fluid from somewhere comes and it ends up into his stomach somehow. And when I say like fluid, I'm talking like liters of fluid. And so imagine like your stomach blowing up with fluid. That's pretty much what it was doing. And every few hours they were pumping out, I think they said like 7 to 9 liters of fluid. And this fluid is like gastric juices and acid and all of that fun stuff. And that, so that made him really, really uncomfortable when that would happen, when like the fluid started to build up. And he just kept dealing with that, all of this fluid just building up into his stomach. So they ended up keeping an NG, like a tube in his nose, and so they could just constantly, like every few hours, just take out all of the fluid. So now the reason that all this fluid was ending up in there is because they would do an ultrasound on his small intestines, and they realized that his small intestines were not moving. They would want to see like contractions, and there was nothing. And they said it's called post-operative ileus, if you want to Google it, but it's not abnormal after colic surgery and after as much trauma and all that stuff that he went through, but it's not good. So it's almost like, when he was asleep in anesthesia, like his small intestines just never woke up. So anyway, they said, it's okay, we'll give him some time. So, I was at the horse show this whole time, Friday, Saturday, and by like Saturday, we still didn't have any sort of movement. And they said, let's try this drug, and it's called metoclopramine, I don't know, and let's try this drug. It is like a nerve stimulant type of drug, and it stimulates those nerves of the digestive tract and the small intestines to move. So we can try this drug. It's not approved in horses, it's approved in people, but there's a lot of like cases where it works really well in horses. But they were also warning me of like some crazy side effects, that it can make them like neurological or just kind of crazy. The way they made it sound is like very agitated. And I'm kind of picturing, I don't really understand it all, but I'm thinking it's because it stimulates things, so maybe stimulates their brain. I don't know. But that was like scary for me, but really we didn't really have any other options. So I decided that we would try it. And they said that it only works in viable tissue or viable small intestines, and that usually it'll work within about 24 hours. So I started that late Saturday morning. And Sunday morning, they ultrasounded again, and there was still no movement. And that's when, it was a little bit doom and gloom. Sunday night, they gave me a call, and there was still no movement. And he was still refluxing a lot. So that wasn't good, because, when I say refluxing a lot, that just means he had a tube up his nose into his stomach, and then he had a bucket over his nose for 5 days straight. They would take it out here and there to give him a moment to be a horse, but even if he wanted to eat, he couldn't. He could, but it would go into his stomach, and it wouldn't have anywhere else to go because his small intestines weren't moving anything. So Sunday night was really, really rough, because I really expected that we were going to have to make a hard decision on Monday. 5 days is the max that they will really let the small intestines go without any sort of movement. So they had already kind of warned me that Monday was day 5. You could kind of vary the hour, I guess you could say, but I really thought on Monday that I was going up there and we were going to have to just make a hard decision. So Monday morning, they called me and they said they did an ultrasound that morning, and I kid you not, 4 days and about 22 hours, they saw a little contraction, a little movement on his small intestine. Not a lot, but they were doing something. And they said that overnight he had only produced 2 liters of reflux fluid versus producing 7 to 9 liters every few hours. So he went the whole night and only produced 2. So they took out the tube just to see if he could remain comfortable. And Monday afternoon or evening, he was still doing okay, nibbling on some food even. And Tuesday, I went out there, and that was when I kind of posted my little video. I'd say it was just a happy video. I was I thought this was like the uphill climb. Like, it was going to be an uphill climb, but we were moving up. So I was really excited. Things were moving, literally. So he was nibbling on food, and he was seeing perky and everything, and so that was good. On Wednesday, he just got a little bit, I think the word they used was punky. His energy level just kind of like tanked, and he just, I don't know, we went out there and he just seemed a little bit dull and just a little bit spaced out and just didn't really want to eat. He was like, nah, no thank you. And the energy level just kind of kept just being so. And then he started to have diarrhea, and he was straining to have diarrhea, which is like odd. And the weird part is that they were ultrasounding him, and in his small intestine they really couldn't see much inflammation anymore. But now it seemed almost like his large intestine was real angry, and he was like developing like colitis. So, they started him on some Saccharomyces. It's like brewer's yeast, which is like a fancy name for like a probiotic, I think. And trying to kind of help heal some of his gut stuff. They also started him on some ulcer guard or GastroGuard, whatever, because Lord knows he's probably got ulcers from literally having a stomach full of acid for a week. All these little things, just because we're trying to just see, like, okay, is your stomach hurting? Is that why you don't want to eat? And just a bunch of little things. Nothing like major, but just a bunch of little things. But the biggest thing is that his appetite was just not good. So that was kind of, I wasn't able to go out there on Friday, and we're not allowed to go out there on Saturday and Sunday. They don't really have visiting hours. But he seemed to do kind of just hold steady throughout like the weekend. They said they did end up ultrasounding him, I think, on Sunday, and they saw some inflammation in the small intestine again. Now, they don't know if it is old or if this is new inflammation. They're suspecting that it's old, and they just couldn't see it at one point because there's 70 feet of it, and so depending on where you have your proby thingy, you can't always see it all. It can kind of move around, but it still meant that there was some sort of ongoing inflammation, and that it would cause him to just not feel great, and for his stomach to hurt, and just things to just not be moving right. So they'd already kind of backed off most of his pain meds. He was backed off of his antibiotic. I'm trying to think about what else he was really even on anymore. I think they still had him on Tylenol. Who knew? I had no idea horses could have Tylenol. But they decided that they, kind of as a last ditch effort to just, we're kind of like wrap up this whole inflammation thing, is to try a steroid. And for a lot of people, like in human medicine, they're like, why wasn't that like your first choice? Like steroids are amazing for so many different things, even in horses, but they come with like a really big risk for horses, and that one of those big risks is laminitis. That's a whole nother discussion. But so the good news is that he's young, lean, and never has had a foot problem before. So he was a pretty good candidate for the steroid. So they started him on a steroid on Monday. And then I think Monday night or Tuesday morning, they did notice a little bit of a digital pulse, which is not good. That can be like the start of laminitis. So that had everyone kind of worried. So then they backed off the steroid, and the digital pulse went away. So right now it's kind of a game of keeping him on a steroid to reduce the inflammation as much as they can, while also not giving him so much steroid that his feet get really angry. So that's been kind of fun. On whatever day I posted a video, was it Tuesday? Yeah, Tuesday. He just seemed really, really sad, just kind of just defeated. And it was almost like when he ate some grass outside for me and stuff, and then he ate a little bit of hay, and literally they've just been like throwing everything at him. It's like, whatever you want to eat, you can eat. I mean, most of the time I'm like against mixing it up and changing things, but all that's just out the window. It's like, whatever sort of calories you will eat, go ahead. And he just seemed like he was kind of like in pain almost after he was eating. And it was just kind of sad to see. I don't know. I can't really explain it. He just seemed really And the vets are amazing there. They've just been so optimistic but also real with everything. And I don't want to say like they're only seeing them for a few minutes, but they're really they themselves are only seeing them for a few minutes. And then all the nurses and all the students there are also so amazing. But once again, they're only seeing them for a few minutes. And they also don't know what his normal is. Not that I'm expecting normal, but I feel like if one person just watched him all day long, though, they would just kind of notice like just some odd things. And obviously me spending like a full hour with I just felt like I noticed a little bit more. But like I said in my post, there's nothing really else we can do. I mean, yeah, if money was not an issue, there's always something I guess you could do, but it is an issue, and the options are not like unlimited for us. So right now he is just tapering off his dose of his steroid, and he is just kind of being monitored. Something's not right. I don't really know what it is. I've kind of told a couple people that it'll either get better or it'll get worse. And I'm kind of prepared for either, to be really honest. I don't deal well with change quickly. I can be really dramatic myself, but I've had a lot of time with this, and I don't wish this on anybody, but I've had a lot of time to just think about the what ifs and all of the things. And yeah, I don't really know what's going on in there, and I'm hoping that it's just a time thing. I really am, but no one really knows. So, and like I said, there's nothing really concrete for them to fix. He's not, even if money like wasn't an issue, he's not a good candidate for surgery again. He's not, there's nothing to fix or even explore or anything. And so it's just kind of a waiting game. But yeah, I appreciate everybody checking in on him and me. Like I said, it's been really exhausting, really, really exhausting. Good news is, though, I know exactly how to get to MSU's large animal clinic, and don't even need my MapQuest anymore. I know a couple different routes, so I'm your girl if you need to go. Feel like I'm friends with everybody there. But yeah, I appreciate everybody's well wishes and prayers, and yeah, stay tuned.